Hi, class. Okay, I refuse to get behind schedule again. So we are going to finish our adaptations to training lecture. We have 13 slides left. So this will be the lecture that you watch today, or at least before class on Wednesday. And then Wednesday, we will start our next lecture. We will also be getting 2 answers to the questions in your assignment. And so I will pull up those 2 questions that we're about to answer, and then I will get into our last 13 slides of our adaptations to training lecture. So be patient with me as I am flipping from sharing my screen and doing that this entire little lecture. Okay, so first let's share and let's look at our assignment. So we have 2 questions left, like I said. So 2 and 3, we're going to describe how bone tissue and connective tissue can adapt via resistance training. You're going to describe what factors cause bone and tissue to break down over time as well. So that's going to be our first topic. We're going to spend the first part looking at how bone can adapt with resistance training and what needs to be in place in order for that to occur and kind of the process of that. And then also there's a few factors that may cause bone and tissue to break down over time. And then the second question is looking at describing the phases of overreaching, overtraining, and then what happens with detraining and retraining. So we have like 3 different kind of terms here. So overreaching, overtraining, we're going to talk about that together first. And then you're describing, okay, so what happens when I go through like a detraining period? What's kind of the process of how we like lose adaptations? But then what happens if we start retraining again? How quickly do we get those adaptations back? So 2 and 3, and then we will hopefully be in class on Wednesday and be able to answer number 4. Okay, stop share here, and let's share now to our lecture. If I can blow this up though. Here. Okay, sharing. All right. Okay, so this kind of starts us off looking at adaptations to bone. But before I get into the actual adaptation part and how we're building, we're first going to talk about how we can lose bone tissue. So first, we can read our statements here, and we see that calcium in bone, we can lose that very quickly within 2 to 3 weeks of an unweighted event. When we think of unweighted events, I want you to think of like bed rest or immobilization. So if you have an injury that you can't weight bear, so can't bear weight on like a limb for several weeks, we would actually start to see calcium loss from bone in an instance like that. So it occurs very quickly. Another unweighted event is like space flight, but not like any of us are going to be going into space. But so that's kind of how we would see loss of calcium very quickly. We just lose those mineral deposits. If we look up here at our normal bone versus osteoporotic bone, we can see porosity is the word here. So when a bone is more porous, we're looking at like voids or spaces in the bone. So that's what porosity is referring to. So osteoporotic bone is just these greater voids, these greater spaces where we don't have all of this lattice work. So what we see in the normal bone, we describe that as like this lattice work of bone deposits, mineral deposits. Where with the porous bone, we see the loss of those minerals over time. So usually we don't see osteoporotic bones until we get into older age. And we'll talk about this with loss of estrogen and loss of testosterone, which is bone protecting hormones. Without, or when those hormones decrease with age, bones become more porous. We also see here that inadequate rest and recovery, excessive repetitive loads can lead to stress fractures and result in something called resorption. So I have this little, what do you call that? A seesaw down here. So resorption versus formation. And so resorption is this loss of bone. It's basically loss of calcium or mineral deposits that occur over time, and where those minerals are not deposited back into bone. If you've taken exphys, which I know you all have, you learned about 2 hormones. One is calcitonin, and the other is calcitriol. So calcitonin and calcitriol, they oppose each other. Calcitriol is also parathyroid hormone. So parathyroid hormone and calcitonin they work opposite of each other. Basically, we see one increases osteoblast, which build up bone tissue. The other increase osteoclast, which break down bone tissue. And so with resorption, this is when the osteoclast are stimulated and we lose calcium, we lose mineral deposits into the bone. And it's basically this decrease in bone mineral density over time. And it can also occur with excessive repetitive loads. So excessive repetitive loads, think of our weight-bearing activities, which we know weight-bearing activities like running, sprinting, high-intensity type work is really beneficial for building up that bone tissue. But without rest and recovery and those days off from our workouts, this can lead to stress fractures. And then a stress fracture that doesn't heal can go through resorption. But if I look here, we see two sports, swimming and cycling, where these athletes actually have the lowest bone mineral density of any athlete. So our weight-bearing athletes tend to have higher bone mineral density than our swimmers and our cyclists. And then this is especially true if these two athletes here are not engaging in resistance training outside of actually practicing their sport. In order to have bone mineral density build up, there has to be weight-bearing forces where force vectors are being like shot through the spine or the hips, the pelvis. So with our swimmers, basically unweighted event. Our cyclists, we see a little bit higher bone mineral density. It does depend on what type of cycling you're engaging in. So we have three different groups of cyclists. We have mountain bikers, we have distance cyclists, and we have sprint cyclists. So our mountain bikers are going to have the highest bone mineral density, and then followed by the sprint cyclist, and then last our distance cyclist, a little bit less. So again, if you are engaging in these sports, probably beneficial to add a resistance training component. Okay, so next, what we were going to do in class is look at a DEXA scan. So DEXA scan is a really neat tool or assessment to look at bone mineral density and body fat. So DEXA is the gold standard for assessing bone mineral density. And it's very good at assessing body fat as well. And so we look here at this female. If we look at her age, so if we see age down here, we look up at this black little dot. The black dot says she's 25. So she's 25 years old, and she is in the lower range on bone mineral density. If we go down here and we look at AM centile down here at the bottom, we see 29. So what this 29 means is, so the AM centile is age matched percentile. So basically it's saying that she's in the 29th percentile for bone mineral density for females age 25. That's very low. So she's on this lower end, and we're wondering why, because she is very young and we don't know her health status, but usually younger females will not experience this. And so what we look at on this slide is we see this breakdown. And so the lumbar region of the spine, which is where we see lower bone mineral density, we see the femoral head, so the femurs, and then the ulna and the radius. And if we look, her lumbar spine is actually in the normal region. It's on the lower side, but still we'd say that's normal. Same thing with her ulna and her radius. So her wrist, also normal. But we come down here and we look at the heads of her femurs, and we see she's on the edge of osteopenia. So osteopenia is right before we get into osteoporosis. So it's like this window. We have normal bone mineral density, we have lower bone mineral density, osteopenia, and then osteoporosis. They classify loss of bone tissue looking at standard deviations. And so osteopenia is like more than one standard deviation past the average adult mean. Osteoporosis is like 2 standard deviations like past the average adult mean. So she's considered osteopenic. And my question for the class would have been like, why? Like, why do we think she has this low bone mineral density for being a 25-year-old? And so this is when we would talk about all of these different reasons. And I'll mention a few. It could be due to poor diet. inadequate caloric intake. It could also be due to not enough, minerals, not consuming enough calcium or vitamin D. It could also be due to lack of weight-bearing exercise. So not engaging in, resistance training or any load-bearing type work. She could be a swimmer or a distance cyclist. She could be disabled in her lower extremities. And so we don't know exactly why, but it's interesting to see a young 25-year-old kid be on, the edge of becoming osteoporotic in her older years. So let's talk about how this female is not completely at a loss, because we can create new bone formation. And so this is the next part. So we've talked about like kind of what we see like loss wise, but now let's talk about, okay, how can we build bone back up? We can create stimuli for new formation, but bone has to be stressed via weight-bearing force in order to adapt. And so this is based on the concept of Wolff's Law. So Wolff's Law is basically saying that if we load bone over time, the bone will remodel itself. And when we talk about remodeling, it's where we see calcium deposits and mineral deposits like inserted back into the bone. And this is a natural process, but we have to have this weight-bearing force. In order to see weight-bearing force over time or have this occur, we have to reach a threshold level of stimulus. So a threshold level of stimulus for bone formation is called reaching the minimal essential strain. So the minimal essential strain, this MES, you can read, it's 1/10 the force needed to fracture a bone. So think if you've broken a bone, which I broke my foot in high school, and a lot of force from my body, landing on my foot to break this bone. And so think of just 1/10 of that force. We need a force large enough to cause stress, but not a force large enough to obviously cause a break. And it's better if this force is distributed across the entire bone rather just in one spot. And so if we look at this picture right here, we have to have some sort of force, like this amount of force. So it can be like a compression force pushing down, a torsion force, which is kind of like a twisting force, or a bending force. And all these different forces can cause the bone to be stressed enough to where we have new bone formation. And so it's really neat. But I want to say that the minimal essential strain is different for everybody. Okay. Let's take a young, healthy individual like yourself. The minimal essential strain for you is greater than somebody who is, 50, 60 years old. So for a young, healthy adult, minimal essential strain could be like repeat maximal sprints, for, in a given workout. It could be doing some sort of back squats, deadlift type work with, a few additional plates on the end. For an older adult, it could be just like a brisk walk or just doing body weight squats. So think about, again, it just depends on the person, the age, the status of their bones at the time. But we need to reach this in order for formation to occur. And so this here is the process of bone formation. So first, if we look at our picture and we can see our words up here, we have to have a force that causes bone to either bend or be compressed or have this slight twisting force. And so the force applied will then cause these osteoblasts to become active. They migrate to the area that was experiencing that stress or that strain. They lay down collagen fibers. So they lay down collagen fibers. They basically these cells that help to rebuild up this tissue. And then over time, those collagen fibers mineralize, and that mineralization increases the diameter. So it's this is a change to compact bone. Compact bone is like the outer shell of the bone, whereas trabecular bone is bone that's on the inside of the bone, where the latest work of the bone is. It's actually easier to change the latest work, the inside of the bone, rather than the compact bone. The compact bone, that dense outer shell, is a little bit harder to see changes and adaptations over time, but this process right here is changes to that outer tissue or that outer shell. Like I said, the trabecular bone, the inside of the bone, we can see increase a lot faster. So yeah, let's talk about how do we get this process to occur. So factors that stimulate bone growth. So again, this is all with like lifting, okay? So intensity, we need to be doing heavy loads. Again, nothing heavy that's going to cause too much stress or strain and cause like joint issues. So a heavier load than what you normally do. Okay. Think of it that way. Speed of loading. We actually have to do fast contractions. So I know it's hard to do fast contractions with a heavy load. So this is actually more of a power focus. So that speed of loading is fast. Volume is high. Okay. You think, okay, now I have heavy strength, fast contractions with power, and then a high volume, which is like a hypertrophy type focus. We have to have all of those in order to see bone change. Okay. And then direction of force, we have to have force vectors being shot through the spines and through the spine and through the hip. So structural or overhead type exercise. A structural would be anything that loads the spine directly, like back squat, front squat, or an overhead press. So think of anytime this barbell is on my back or over my head, those force vectors are being shot through the spine. And then I want you to think also indirect loading. Deadlift. Deadlift will indirectly load the pelvis. So another great way. Progressive overload. Again, we have to steadily be increasing this weight over time. And that's going to be the best way to prevent the injury part and then also see changes to bone. So yeah, these are our factors that need to be present in a training program in order to see bone change. You see down here in this picture, mechanical stimuli, bone remodeling. Again, it just talks about the osteoblast. We want to inhibit osteoclast, the breakdown of bone, and activate osteoblast, which help to build up or lay down those collagen fibers and have the bone change over time. Okay, so next little part here is about connective tissue. We just have this one slide on connective tissue. So with connective tissue, think of tendons, ligaments, anything that kind of is within the knee joint, or I say knee joint because we're looking at knees, but it could be any joint. So any joint. The knee joint, though, is especially important because this is where we do see lots of injuries. So connective tissue, we can make tissue stronger and we can increase its load bearing capacity. So there are three kind of places that we can see changes to tissue. So first, between the tendon or ligament and the bone surface. So that connection point. We want to increase the bond between the tendon or ligament and the bone. So we want to strengthen that connection point there between the two. Next, within the body of the tendon. So if we look down here at kind of the collagen bundle, the collagen molecule itself, we can increase the strength of all of these collagen molecules that make up the either tendon or the ligament. And then also the network of the fascia. If you look down here at this ligament, what is that? Like the MCL. So MCL, so the medial portion, the medial ligament there. If you pull it out, it kind of looks like muscle tissue. But it's, instead of being made of like myocytes, it's just made of these collagen bundles. So collagen instead of muscle. But anyway, so we can strengthen the wrapping, the fascia. So the network of the fascia is the wrapping of that collagen bundle and make it stronger. How do we do that? Stimulate adaptations. Again, high intensity loading patterns, multi-joint exercises through a full range of motion. Anytime we move through a full range of motion, we're applying weight to, entirely stretched out muscles, we're basically just distributing or spreading the force across a larger area when we go through full ranges of motion. And so with these multi-joint exercises performed at full ranges, we're able to target all aspects of muscle, all aspects of the tendons, the ligaments, and make them stronger. And we all can benefit from this because I'm sure we have all had some sort of joint issue with connective tissue, either overstretching, like a strain or a tear. And we can maybe not prevent, but we can improve, or we can mitigate or minimize the injury risk. Again, it's just with training. So with resistance training, we're not only impacting muscle, we're impacting bone and connective tissue. Okay, cool. Okay, so now we're on to our next topic. Our next topic gets into overtraining. So overtraining has different phases. Before we hit overtraining, we actually go through two kind of other phases. So the first one is functional overreaching. We see the definition, excessive training in the short-term basis. With functional overreaching, it can be within a few days to a few weeks of training that we may experience this. Give me just 1 second. Hold on. So let me pause this really fast. Okay. Sorry, let me get back to sharing that screen again. Here. Okay, so talking about overreaching, short-term basis of really increasing the intensity of your training, the frequency, volume, whatever it is, we're increasing these variables, short-term basis. We get rest though, after a lot of this high work, okay? We see here that it can be a planned phase in a training program. Normally, I would ask y'all, why is functional overreaching considered to be a planned phase? I want you to think of like football players doing two-a-days in the off season. So in the off season, two-a-days before we get into that preseason or we get into that the in-season games. So I would ask you, what's the purpose of doing two-a-day type work? Or training for multiple hours a day in the off season leading up to the preseason. And normally I'd have, lots of people say, to build our physical capacity and to increase our work tolerance. And so that's the purpose of functional overreaching, is we're increasing these athletes' tolerance for higher intensity work. We're building a base of fitness. So functional overreaching pushes these athletes to train such a high volume, pretty high intensities for several days, up to several weeks of using this type of work. And we're establishing a base of fitness, and it's like our conditioning part. And what this base of fitness does is it helps us to handle higher intensity loads later, like in the preseason and the end season. And so again, we're just prepping these athletes. We're prepping our bodies to be able to tolerate greater stuff later on. Okay, so that's functional overreaching, but we get rest here, okay? So functional overreaching, we get rest, and then we recover, okay? So if you look down here at this graph, we see level of fitness on the y-axis, and we see workload. And so what we see is we are increasing our level of fitness as our workload gets to like this intermediate point. And so this green circle there, that's our overreaching. So that's our overreaching. We have a high level of fitness with this intermediate work level or intensity. And then we get to rest, and that rest prevents us from going into this overtraining phase, okay? So before we get to overtraining, we get to something called non-functional overreaching. So instead of being functional, where we have high fitness levels and high performance levels, now we're non-functional, okay? We have been training at this pace, intensity for a longer period of time. So past our functional overreaching, and now we start seeing performance decreases. So now if you look at this graph, we're in between overreaching and overtraining. With being in between the two, we start to see our performance levels go down. And the whole reason this starts to occur is because we did not give our body enough time to recover. So due to lack of recovery, lack of rest. So for this functional overreaching, we're now into like this weeks to months of doing high intensity type training without adequate rest and recovery. Okay, and then we get to overtraining. So overtraining, I want you to think of this as a syndrome, okay? It's a collection of symptoms and behaviors, and you are not considered to be overtrained or have overtraining syndrome unless you have several of these symptoms and behaviors. Research actually shows that it's really hard for athletes to get into this overtraining phase. So if you're sitting there and you're thinking, I've been overtrained, I feel like I have been overworked in, my high school career, college career of training. It's probably just non-functional overreaching. Because on the next slide, we're going to look at these collection of symptoms and behaviors. And maybe, sure, some of y'all have experienced this. And so overtraining, it takes months or more, several months to get to this point. It's not just several days. It's not just several weeks. It's several months of high intensity training without rest. And then we start to see our performance go down. So these are 3 phases. So we have functional overreaching, non-functional, and then finally we hit that overtraining syndrome. So let's talk about anaerobic overtraining. I want you to know there's a difference between aerobic overtraining and anaerobic overtraining, okay? We're just talking about anaerobic. So just so you know, the aerobic overtraining symptoms are actually a little bit different. So here we see obviously increased fatigue. The body itself feels worn down. Decreased glycolytic capacity, which means our glycolytic system is inhibited, possibly due to these enzymes not working correctly, due to lack of glycogen content in the muscles to go through glycolysis, this poor glucose regulation, which results in decreased force production, motor control. So our strength levels go down. We have altered motor control, our fine motor movements, our skills are lessened, loss of appetite. We don't feel like eating. We don't have an appetite for food. Mood disturbances start occurring. You start to feel angry because of this burnout that you're experiencing. Sleep disturbances. You can't sleep. You have trouble falling asleep, staying asleep. Altered immune function. You may start to get sick. Or infection levels start to rise. And so your immune system is depressed. We see higher blood pressure and resting heart rate is elevated. So my question here is what mistakes in training can lead to anaerobic overtraining? And obviously the first one is not enough rest and recovery. And so not enough days off in your training can cause this. And then also we can get into the program design variables. So either your intensity is too high, the weights that you've been using are way too high, dialing it back, going through an unloading, detraining phase would help. Your volume's too high or your frequency is too high. So any of those 3 variables too high, you're not getting enough sleep. So you're not hitting your 8 hours of sleep every night. You should know at this point, and if you don't already, sleep is when the body recovers mentally and physically. And it's due to this is when growth hormone increases as we sleep. Growth hormone plays a role in repairing damaged tissue, helping to heal muscle in our sleep. And so if we're not sleeping, our body's not recovering. Poor diet, poor nutrition. High dehydration, not consuming enough water. So your cells, you're not hydrated on a cellular level, not consuming enough protein, amino acids to repair the damaged tissue, not consuming enough carbohydrates to fill up your glycogen stores and contribute to your blood glucose level. So you don't have energy. Several factors lead to this. Consuming alcohol post-workout, which inhibits the repair of muscle tissue. It inhibits glycogen synthesis. So all of these factors can lead to overtraining. I have this really great video, but I'm not going to play it. Y'all are going to watch it. Okay. So it's 6 minutes and it's all about overtraining. And I want you to go through that video because it will help you answer number 3 on your assignment. And it's really fascinating. So for anybody who exercises and lifts weights, or does any type of work, we want to understand our body and how our body responds, with too much training, not enough rest, So please watch that 6-minute video. The link is at the bottom. I hope you have it on your slides. If not, I'll send it to you. Okay, so almost done. Let's look at this little chart here. You can use this chart when looking or answering that question on your assignment as well. It just talks about stages of overtraining, starting with acute fatigue to functional overreaching. So with acute fatigue, you're just fatigued, no effect on performance. You may actually see an increase in performance. But then you get into functional overreaching, temporary decrease in our performance, but we return to baseline pretty quickly with some rest. And then we get into the non-functional overreaching and the overtraining syndrome. So you can kind of read through those last 2 rows, looking at kind of all the changes that have occurred. And it's a lot of what we mentioned, and it's a lot of those symptoms and behaviors that we just kind of went through. Okay, now on to detraining. So detraining, if we read detraining, we see the cessation of training or the reduction in one of our training variables. So we're either stopping training completely, or we've seen a drop in frequency, a drop in volume, or a drop in intensity, or a combination of. And so with detraining, we basically will see several factors also drop. And so we'll get into those. First, we see loss of strength values due to this reversal of the neural adaptations that were once established. If we look at this graph right here, we see increase in like MVC force, EMG signals, and cross-sectional area. These participants in this study trained for 60 days. They had 60 days of training followed by 40 days of detraining. So the stopping of training. And this is what happened from their 60 days of training to now they completely stop their workouts. So that what we see is our EMG, if you look at the red, EMG over those 60 days have a very steep increase in how much their EMG signal has changed and how much larger that EM signal has gotten. What is that due to? That we've learned increased motor unit recruitment, increased activation of type 2 fibers, and that directly relates to greater force. So their MVC force is greater. And then we see after that 60 days, we see this sharp drop in that EMG signal. So within even just those first, few days, a week, 10 days, 20 days or so, we see a complete drop in that EMG signal. But the next point here is loss of hypertrophy cross-sectional area occurs at a slower pace. So we're not going to see loss of hypertrophy decrease or diminish as quickly as we will see loss of strength. We can actually maintain our strength, our size levels, our hypertrophic gains for a longer period of time. And we can see the gray here. The gray steadily increases size of the muscle. And then with that detraining, it basically stays the same with some small decreases in size. Pretty interesting. Here I have a larger kind of, we'll just get into it. So effects of detraining on size and fitness. So strength loss is actually most dramatic in that first week. So the 3 to 4% per day, that sounds crazy that we lose that in the first week of detraining. We also see both type 1 and type 2 fibers are effective in regard to strength and size. We can see maintenance of dynamic strength, which we know is moving through a large range of motion for up to 12 weeks, but this is with just a decreased frequency, which means you have maintained your intensity. So maybe instead of training like 4 days a week, you're now just training 3 days a week. And so with these 3 days a week of training, your intensity is still high. Okay. So it's still the same. That's why you can maintain for up to 12 weeks. But reduced intensity, we see greater decrements. So let's say you are doing 4 days a week of training, but so you keep your frequency the same and you just drop your intensity levels, which means like your weight, you're not lifting as heavy. We're going to see greater decrements like with this type of training. because we're using like loads lower than what the body can handle. So we're using detraining loads rather than stimulating loads or maintenance loads. And so when we're not using a maintenance load, when we're not using a stimulating load, we're going to see decrements. So we see decreased strength because of our intensity is reduced. We talked about this previously. Compared to endurance training, the rate of detraining with resistance is a lot slower. If we look at aerobic athletes who go through a detraining phase where they stop training, it's more dramatic losses in VO2 max and running economy and time to exhaustion. So endurance training, we reverse faster. With detraining, where resistance training, it's a lot slower process of reversal. Again, this also goes back to the principle of reversibility, where if we stop training, if we reduce any training variables, if our cessation is lost, or if we go in through cessation of training, then we're going to experience lots of changes to tissue and strength. Last slide, retraining is what this says up here. So retraining, strength gains decrease slowly. Yes, I said, they do decrease quickly at first, but in the large scheme of things, it's slower and they don't return all the way to baseline. So when I say baseline, I say when you first started training. So if I start training for, let's say like 5 months. Okay. So 5 months of training, from where I was at the start of the 5 months, I work all the way up for 5 months. And then let's say I go through like a few months of detraining. Well, I'm not going to return all the way to baseline from like exactly where I started those like 5 months ago before I started training. Our strength, it's rarely lower than pre-training values. And the pre-training values, again, is when you first started training. So we don't return all the way to baseline, which is really great. Why? Muscle memory comes into play here. So muscle memory, validation, and retraining. And again, it's due to the myonuclei of our myocytes. So muscle cells, myonuclei, the nucleus of the muscle cell, has this kind of memorization of like this programming of like the intensity we use, so like the loads we've used, all of our adaptations that we have established, and can quickly return us back to where we were. And so when we look at these two graphs down here, we see this is maximal strength for leg extension. So think of leg extension, strength values. We have our trained individual. So trained individual, they go through a detraining period, and yes, they see this loss of strength by 31%. But look at our retraining period. So with our retraining period, they're able to get back a lot of what they've lost in just a shorter time frame. And again, it's this muscle memory. The myonuclei of our myocytes have this ability to regenerate quickly with improving our strength and size back to where it was. We look over here, we have trained, detrained, and retrained. So type 1, 2A, and 2X fibers. So this is where we are. And this looks at cross-sectional area. So the size of each of these 3 fibers. And then with detraining, we see, loss in a small amount of loss in our type 1, greater losses in size of our type 2s, which again is very fascinating. So type 2 fibers decreasing to a greater extent. But now look back with the retraining. We see the retraining, and we see actually even greater sizes than we were with our trained initially. So with retraining, we can get exactly back to where we were and even greater. And so the point of this is, if you have gone through a detraining phase where you're not training right now, you've taken a break, you're injured, whatever it is, don't fret, because the retraining potential of your muscle cells is really high, and we can retrain and get back to what we've lost. So yeah, that's basically what our lecture was about today. And there's one more video. This one's shorter. It's like 3 minutes. It's awesome. Please watch it. It goes into all about detraining and retraining and getting back to where you were. So it's a really quick, short, awesome video. So please watch those 2 videos. But that is all I have for you today. Thank you for watching this video. Now we will be caught up for Wednesday. And you can answer those 2 questions on your assignment. If you have any questions over anything I went through in this lecture, please reach out to me and let me know, and I will see you in class.